I went into the emergency room for another problem. I had chest pains, and I went in for that. And once I found out I was in there for chest pains, it just turned out to be gas in my chest. But they told me I was a diabetic and I had hypertension too. So I didn't know until I went in for another reason.
I kept complaining of a headache to my neighbor, and my neighbor said after 2 or 3 days of this headache that I should probably go to emergency and have it checked out, which I did. Come to find out, I had high blood pressure, and I was pretty young. I was in either 26 or 27 years old.
I was in disbelief, but really, once, my mother has it, my grandmother had it, granddaddy, uncles, I was in disbelief that I didn't want to believe that I had it too.
My family was there with me. I was very happy they were there, and when they left, I began to, I think, worry a lot because I didn't want to be left alone. I ended up having a stroke that night, which I didn't know until the next day because they took me to the neurologist, and he confirmed that I had had 2 strokes.
Probably the most important tip to give somebody who's just been diagnosed with hypertension is that it's a manageable disease. It's not a death sentence. You're going to have to make some lifestyle changes, which tends to be the most difficult for patients to do, is lifestyle changes.
Quitting smoking, cutting back on alcohol use if you use alcohol, making sure that your sodium, the sodium content in your diet is low, because sodium or salt can really contribute to high blood pressure.
One of the things that we do when we talk to our patients about eating a low salt diet is we have a diagram where we kind of show them what are considered lower sodium foods, moderately sodium foods, and high sodium foods. I don't tell them always to just avoid the high sodium foods, but those are the things they have to be careful of and limit how much of those things they have.
I don't use salt, period.
Okay.
Yeah, no salt whatsoever for me. So the food that I eat is no salt. Like I said, only salt or sodium that I end up eating is if I open up a can or something.
I try to eat the right foods. The salt is not good for me, for anyone with high blood pressure. So I try to stay away from the salts, away from the fats, because you have your kidney, your cholesterol, everything is out of whack when you're doing wrong. And I love those wrong things that are not right for me. So I'm doing the best that I can right now with my foods.
I have noted that with some patients that they get a little anxious about coming into the doctor's office. And so they will have a slightly elevated blood pressure. And rather than treat that type of blood pressure, I ask them to do it whether it be at home or at a store or even at a health fair in order to see what their blood pressure is running outside of this environment.
We also talk about how to read labels so that they can really see what a serving size is, and so that they can also factor that into their daily diet.